you talked a little bit about prolonged grief disorder.
Yes.
Talk a little bit about what that is.
So it's a newer diagnosis, and there was a group of people advocating for its inclusion into the most recent edition of the Diagnostic and Statistical Manual of Psychiatric Disorders, because they believed that it was important. It's a layer of suffering that existed that was somewhat ignored, I think, in our culture, which is that there are forms of grief that are differentiated from what would be, quote, the normal range of experiences. And so prolonged grief, in the trajectory of the grieving process, there is a sort of pathway or a range of experiences within a pathway that would be considered normal, right? And you start off in this acute phase of grief, and eventually it abates into this integrated phase of grief where you have resumed your regular activities. It doesn't mean that the sting of the loss is any less. Losing a loved one is really a profound, lifelong, impacting, life-changing experience. But the acute level of distress of having a recent loss or a traumatic loss, it's different than when you've integrated that experience into your life and you have moved through some of the grieving process and you're back at work and you're socializing again and you're doing a lot of the things that you were doing before you lost the person.